Now, this patient was referred for removal of fractured teeth numbers 4 and 5 with grafting. Once the patient had healed, we brought the patient back, we got the CEREC scans, and we got the cone beam. So let's see how we plan a ghost implant. So the first thing that you do here is you align the crosshairs up right over tooth number 3, or the implant that had been placed about 10 years ago. And really, once that's all set, the next thing that you're going to do is go ahead and set up and place the ghost implant. Now, why is it a ghost implant? Because I'm putting it directly and perfectly over number 3, because I'm going to use this ghost implant on number 3 to parallel the implant for number 5 so we can have a screw retained bridge. So once you've got that ghost implant placed, you go ahead and bring the SSI file in like we normally do to bring in the crown proposal for tooth number 5. Once that's in, you go ahead and you select implant for number 5. Make sure to click parallel to number 3 so it'll make that parallel for the bridge. And once you've done doing that, you go ahead and bring that virtual implant in for number 3, parallel number 3 for number 5. So once that's done, you go ahead and choose your sleeve and make sure your spacing is correct to do the 360-degree turn. And then we go ahead, don't forget, you've got to remove the ghost implant of number 3 before you send it out. You then pick a guide, in this case we use a digital guide, and send it out.